Counseling 6303 for Houston Baptist University, Chapter 15, presented by Dr. John Spody. Sexually transmitted infections. Introduction. Sexually transmitted infections are infections transmitted by sexual contact. The primary reason for the transmission of these diseases is engaging in risky behavior. Risky behavior includes such things as multiple partners, unprotected condomless sex, and oral contraceptives. Highest incidents occur in adolescence and early adulthood. There is a lack of public health measures and limited prevention and treatment actions. Table 15.1 shows common sexually transmitted infections. It shows the transmission process, symptoms related, and the treatment. This is a continuation of the previous table and includes sexually transmitted infections, STIs, such as syphilis, herpes, and genital warts. This table includes some STIs, such as hepatitis and bacterial vaginosis. This table includes yeast infections, trichomoniasis, and pubic lice. This table includes information about scabies and AIDS, acquired immunodeficiency syndrome, and again includes transmission, symptoms, and treatments. Bacterial infections. Chlamydia infection. Chlamydia is the most frequently reported bacterial infection. The symptoms, there are a variety, and they may be minimal. Complications related to chlamydia include chronic, contagious, trachoma, infertility and sterility, preterm birth, and infant conjunctivitis or pneumonia. Treatments are listed, and all sexual partners should be tested. This is a picture of chlamydia conjunctivitis in a newborn. The newborn acquired the infection from the mother during birth. Bacterial infections continued. Gonorrhea, also known as the clap, has symptoms of cloudy discharge from the penis and burning urination. Complications such as fever, loss of appetite, arthritic pain. For men, some complications include prostate, abscessus, painful bowel movements, difficult urination, and possible sterility. For women, it includes PID, ectopic pregnancy, severe pelvic pain, infant conjunctivitis, and the treatment is listed below. Cephalosporin. Bacteria infections continued. Non-gonococcal urethritis, symptoms include, for men, penile discharge and urinary burning. For women, they may have few symptoms such as itching, burning, and vaginal discharge of pus. Complications for women, there can be inflamed cervix or PID. For men, it can spread to prostate, epididymis, or both, and the treatments are listed below. Doxycycline and azithromycin. Syphilis. Symptoms include they're primarily painless, secondary, painless, non-itching skin rash and flu-like symptoms. They can be latent and have no observable symptoms, or tertiary, severe disorder or death. Treatment includes benzathine penicillin G. And in figure 15.3, in the secondary phase of syphilis, a skin rash appears on the body, often on a palm and the feet. Viral infections. Herpes simplex virus, HSV, types 1 and 2. Symptoms include swollen lymph nodes, headache, fever, aches, and painful red bumps that develop into blisters that form sores. Lesions can recur after a complete healing. Complications. Women can have complications of cancer of the cervix and newborn infection, and there's an increased HIV and ocular herpes risk. Treatments are antiviral strategies, suppressive and episodic. Genital warts, or HPV. The symptoms are soft, cauliflower-like warts or dry yellow-gray hard warts. Complications are urinary obstructions, cancer, newborn infection. Treatment is removal of the warts, and prevention is Gardasil. Viral hepatitis. There are different types of hepatitis. Hepatitis A is commonly transmitted sexually with no treatment. Hepatitis B is commonly transmitted sexually, treated with antiviral drugs. Hepatitis C is commonly transmitted through blood-contaminated needles and requires combination therapy. Symptoms include mild flu-like initially and can become incapacitating, yellowed white of the eyes and skin. Common vaginal infections. Bacterial vaginosis. The symptoms include foul-smelling, thin discharge. Complications are increased HIV susceptibility. And treatments are metronidazole. Candidiasis. The symptoms include white, clumpy discharge, itching, and soreness. Treatment are vaginal suppositories or topical creams. Common vaginal infections continued. Trichomoniasis includes symptoms of frothy, white, or yellow-green vaginal discharge with an unpleasant odor. Complications are increased HIV susceptibility, and the treatments are listed below. Ectoparasitic infections, pubic lice, also known as crabs. The symptoms, little to severe itchiness. Treatment, prescription and over-the-counter medication. Scabies. Symptoms, pimple-like bumps, red rash, and intense itchiness, especially at night. Treatments are topical scabiecide. Pubic lice. Figure 15.6 is a close-up image of pubic louse or crab. Acquired immune Immunodeficiency syndrome, AIDS. HIV, human immunodeficiency virus. Immune system destroying virus that causes AIDS. Destroys T4 cells. AIDS is a catastrophic illness. HIV invades and destroys the ability of the immune system to fight diseases. Incidence. Well over 1 million cumulative cases have occurred in the U.S. Rates are rising among teenagers, women, and minorities. Many are infected during adolescent years. There is a high prevalence among men who have sex with men. Heterosexual contact has always been a primary form of transmission. There are an increasing number of women with HIV. Transmission occurs in any bodily fluid: semen, blood, vaginal secretions, saliva, urine, and breast milk. One form of transmission is referred to as mother-to-child transmission. The likelihood of transmission depends on the viral load, greatest when transmitted directly to blood. Small percentages appear to be resistant. HIV/AIDS in African children. African children are often afflicted with HIV/AIDS as a result of mother-to-child transmission. Symptoms and complications. Brief flu-like symptoms that progress depending on immunosuppression. Candidiasis of the mouth and the throat. HIV antibody tests. Most develop antibodies in a few months, but it can take 3 years to seroconvert. Development of AIDS. Usually progression ranges from 8 to 11 years. Treatment. No cure currently exists. Highly active antiviral therapy shows best results for slowing progress. Combination drug therapy. Drug therapy to prevent mother-to-child transmission of HIV worldwide. And the search for a vaccine is the best long-term hope. Prevention is the best solution. Use condoms and avoid multiple partners. Do not share needles. Avoid oral, vaginal, or anal contact with semen. Avoid sexual behaviors involving the anus. Avoid oral contact with vaginal fluids. Do not share items that could be contaminated with blood, such as razor and toothbrushes. Avoid sexual contact with sex workers. Prevention guidelines. Assess your risk status and your partners. Get tested and share lab results. Use condoms. Use microbicides in the future. Avoid sexual activity with multiple partners. Inspect your partner's genitals. Inform your partner if you have an STI. Summary. Sexually transmitted infections are infections that can be transmitted through sexual intercourse. Some are curable, while others are not. Consequences of STIs can adversely affect the quality of our lives. Compromised health, pain and discomfort, infertility, and even death.